My name is Travis Linton, and I'm a physical therapist at Duke Health. When I was in high school, I was an avid soccer player, and so I tore my ACL a number of times. I had surgery, and I also had physical therapy as well. And so going through that physical therapy process, I think gave me an appreciation for PTs who are very compassionate and very caring and very effective at what they did. I'm an outpatient physical therapist, and so I see folks primarily at the Spine Center and the orthopedic trauma clinic as well. And so those can be individuals who have low back pain or who have neck pain, as well as just general orthopedic conditions. My treatment philosophy is one that really tries to put the patient at the center, and I try to be as compassionate and caring as possible. I like to think of my care as very effective and very efficient, and so I'm not interested in stringing patients along for a large number of visits, but I'm interested in getting them better as quickly as possible, and also giving them strategies that they can do themselves, so they don't need to rely on me for their care. Often patients come in and they're really sad or depressed about just the nature of their pain, and they think they're going to be in this life of pain, that surgery is imminent, or that they just can't play with their kids or walk around the neighborhood or go on these social outings, and to be able to give them some strategies and to see the power of exercise and to see just how excited they are to have their life back and to be able to do things that they thought they were never able to do, and just to be a coach along the way, and that they're the ones doing most of the work, and I'm just providing some of the tools.